The dental hygiene program here at Ferris is a way to serve the community and their dental needs.
First and foremost, the program serves students, obviously, because we're a teaching institution, but very, very close. Second, it would be the community.
I did choose Ferris just because I knew that it was one of the top dental hygiene programs even in the nation.
3 of my roommates actually were in the dental hygiene program. They graduated last year. They were the ones who really kind of pushed me to go into it.
The program has been in existence since I believe 1967. And so anytime a program has been around that long, it tends to have some merit to it.
We start our first year students the week we start school, and we are one of the only programs in the state of Michigan that have our first year students start in the mouth in the first week.
We're instantly in the mouth, and I know a lot of people, when I tell them that the first week we're working on each other, they think it's the most scariest thing ever. But with our instructors being right by our side and helping us with everything, it's really not that scary.
Everything we do is hands-on, just about. The students spend more time in labs and clinics than they do in the classroom.
From the first day they come in and they're scared to death and they're shaking and, oh my gosh, where do I go first and how do I do this and blah, 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 to becoming, 45 minutes, they've got a patient done and out of here and ready to get out in the big world and accomplish their goal.
If you think about it, we're going to have to do this in the real world too. We're going to have to try to call up patients, get them in our chairs, make sure that we have someone scheduled so that we're not just sitting around.
My favorite part about the program would have to be, kind of cliche, obviously the clinic though. It's really nice to interact with different people.
Altogether, I'd probably say that clinic is my favorite, just because, well, especially second semester is when we're kind of push on to our own, whereas we don't have an instructor that's right by our side the entire time, so we kind of get a feel of what it would be like in the real world with you just interacting on your own with your patient.
Mostly in first year, you are pretty based on getting a lot of x-rays. You're in the radiology clinic, taking x-rays, working with computers. We get a lot of hands-on with more technology in second year.
Our students are very, very well educated in treating a patient holistically. We look at the entire body.
Well, it's important because the oral cavity is attached to the rest of your body. So, if you have an infection in your mouth, you've got an infection in your body. So everything's connected. So it's important to keep everything healthy.
The mouth is one of the first areas in the body often to show a condition or a disease. And so we are finding and recommending a lot of issues. Sometimes we're the first ones to tell a patient that they have a high blood pressure. We've had patients leave here and go right to the hospital or to their doctor. We check glucose levels in diabetic patients. We have a lot of the same training that a nurse has. It is common knowledge that Mecosta and Osceola and Lake counties are some of the poorest counties in the state of Michigan, and we provide a very valuable service to the residents.
A lot of the community, especially around here, do not have the income or they do not have dental insurance, and they're in real bad need for getting their teeth cleaned or keeping their teeth up, and they can call here and make an appointment, and we take them in and clean their teeth and do their x-rays at a very great cost.
We like to think of ourselves as poster children for Woodbridge Ferris's mission, which was hands-on education so that you can get out in the real world and get a job.
Once I'm done, I plan to do pediatrics. I have visited a lot of pediatric offices in Grand Rapids, so it was really nice to see that and be in that environment, and I think that's what I'm going to work towards to go because it just seemed a lot more comfortable for me.
I definitely feel like going through this program, it's very beneficial, and I think I'll be pretty prepared once we're done.
You gotta be a go-getter, you gotta get out there. You see the ones that are real aggressive and the ones that are very positive and they're just go-getters. They seem to get jobs.
You have to learn to be a very strong individual and you have to be flexible, and you have to learn to be very assertive. And that's a piece of information that I always give them because it's true.